Good morning, colleagues. Let us commence with this business breakfast. We have about an hour and 20 minutes at our disposal. We are going to dwell upon the topic of public health and public health care. As we chose the subject, we immediately were confronted with a number of questions as to what is indeed public health. These are, of course, issues related to economic infrastructure, the human capital, digital technologies, all coming together. We have tried to structure this alongside several lines, including the development of the human capital, the technological and digital reform, and the economy. So we shall be focusing on these topics. Let me invite Mr. Vladimir Mao, the head of the Academy, which is hosting us here today. Mr. Mao, you have in 2016 you published a book which was called The Russian Economy at the Time of Turbulence, and it has a phrase: a country which can make a sustainable model of a human capital will gain a considerable advantage in the post-industrial world. What are the practical measures, in your view, that need to be taken for the human capital to become a priority in the development of this country? Well, good morning. Let me first welcome you to the Academy and thank you for attending and for being here so early. I would like to thank Veronika Igorevna here and the governors, although, as I have been told, the doctors are always up early, which is, of course, true. As we embark on the topic of public health, we should be talking about a host of interrelated issues, all aiming at a healthy state of the society. We were expecting two ministers, Minister Vasilyeva, but unfortunately she had to fly down to Perm for an obvious reason. At any event, we're talking about the juxtaposition of several disciplines, including education and healthcare, including overcoming the drug addiction, and this is certainly something that needs to be remembered. As we talk about the investment into the human capital, it is indeed an internal topic. In the past month, I have recommended the memoirs of Minister Perez, who was minister in the Russian Empire in the last years of Emperor Alexander II. And as I'm recounting this book, and of course every page there is of interest, but talking of the note of December the 31st of 1880, where the Minister of Finance is speaking about the priorities of the Russian budget. That being said, he says that we need to invest less into bureaucracy, and we are not going to achieve success unless we direct budgetary assignments towards the reform of the judiciary and healthcare. So this is indeed a budgetary maneuver in the terminology of the 19th century. But as we speak about the public health care and the public health in that sense, the deliberation about human capital and the infrastructure as major priorities, this is a conversation which is 200 years old. So even earlier, when there was some criticism about Russia as that the country has too many fools and too bad roads. This is also a deliberation about the human capital and the penchant to reform it. As we speak about the material production, we realize that we're entering a new historical period, and as distinct from the industrialization period, we are talking about a new dimension, including a new focus in the state policies. Thus, focus is coming to concentrate on the human capital. And here, let me amend and say that a state which is in a position to create a sound healthcare and public health system will have a competitive advantage in the 21st century. And this is indeed what Mr. Gaidar wrote about. Thank you very much. Let me pass on to the discussion. And the first question that I would like to ask and direct it to a member of our session who is related immediately to the system of healthcare and pharmaceutical industry, but at the same time the head one of the largest Russian associations, Mr. Alexei Repin from Air Pharma, the head of a company which has been in the Martian market for many years. And the question to you, Mr. Repin, is as follows. Public health, is it a business for you, or is it something that is a wider concept? Good morning. Good morning, friends. Thank you, Alexander, for the opportunity to visit and exchange opinions. I think that, and this is something that pertains to everybody present here, and by the exigencies of our careers, but also by the human condition, we are, of course, concerned about our health and the health of those close to us. As we speak within the Business Russia Association, when we talk to the entrepreneurs and the business representatives about the relevance of the subject of this business breakfast, it may seem somewhat strange that persons and people who seem to have no immediate relation to the topic are nevertheless seriously concerned personally, or else regard this as an important element of the environment in which the Russian companies may or may not be competitive. So starting from 2011, Delovaya Россия, the Business Russia Association, has had a flagship task of developing the investment climate in our country, and we have gone this path together with our colleagues, partners, the ministries, the governors of the Russian regions, and at some point, which may have been coupled with the acceleration of technological development in the world, or else this may have been related to added value generated by specific persons and indeed small-scale and mid-scale investments. So this conclusion, which generally became a matter of consensus, emerged, whereby when we speak about the investment climate, we should assume a human perspective. Any changes within an economy, any viewpoint, must be human-centered, because with the mobility of the social mobility, with an ability to create added value in Moscow and Kazan, in Ivanova or in Novgorod, or in Tomsk or in Paris or in Tokyo, we have to realize that our economy must be globally competitive only in case if A, we keep to the people who create competitive benefits for us, and secondly, if we involve them, and thirdly, if we can recreate and replicate, if you will, this human capital, allowing thus to open up the human potential. And as we analyze the reasons as to why people come to us and why, conversely, many people abandon the country maybe seeking a better place to live and work. I think that it is often that the answer is not about infrastructure or about some legal matters, but it is about, first and foremost, about the quality of life. A quality of life is, after all, a simple set of very difficult requirements. It's the quality of healthcare, it's the quality of education, it's the environment, and the infrastructure as we would like to see it surrounding us. And indeed, something that we may be concerned. And we want to make amendments and to make things better tomorrow. So I think that in this we see one of the major priorities, because this feeling of protection only emerges when we understand that the quality of healthcare, when the quality of the healthcare is at an adequate level. So a movement forward, which has been demonstrated by the Russian healthcare system over the past several years, as already reflected in the longer survival rates and longevity, something that makes the country more competitive compared to 10 and 5 years ago. But for us to keep at this level and raise this relay is that we have to continue be moving forward even more dynamically, more swiftly. And in this context, the discussions that are ensuing, we think that the rhythm of these changes is changing at a very high level. So it is important for any business person, for any entrepreneur to understand that Gaidar Forum is just about that, just as much as the discussions in the Russian society in the year that has just begun. So depending as to how we have this debut of the year will influence not only the state of the industry, but also our achievements in the country as a whole. Thank you very much. Well, as one of our colleagues joked, he said that it is very relevant to start a Gaidar Forum with the subject of public health after 3 weeks of Russian New Year holidays. So as we start with this session, I looked at some statistics and I saw that there is a great relation between public health care and the economy, with the GDP increasing 0.5% a year, with longevity increasing every 10 years. So the IMF has shown just as well the dependency between the quality of the education system and the attraction and involvement of high-quality educational professionals into the country. In Germany today, every 7th person is somehow involved into the development of the public health care. And this is something that we have to remember and be in tune with. So let us talk a little bit about the human capital. Major companies, transnational companies conduct business in different parts of the world, and to our company, the Y company, is indeed one of the inhibitors for growth, is a search for highly professional cadre. And this is indeed one of the typical problems that we are encountering as a business, as well as other companies. Major companies, through different encouragement and endorsement programs, are trying to involve professional and talented employees. This is the case with many Russian and foreign companies working in Russia. And if I may quote the example of Coca-Cola, which has been working in Russia for many years with its program. So if I may ask a question addressed to the system and the program that you have developed in Russia.
Thank you very much, and good morning, everyone. First of all, I would like to thank the organizers for inviting the Coca-Cola company to participate in this exchange of views this morning. To your question precisely, I think, well, I don't have the secret formula of Coca-Cola, but I do know that one of our key ingredients for the success of our business over the past more than 130 years is our ability to listen to society, to listen to consumers, and to continuously evolve to take on board societal expectations. And we all know that societal expectations today mean growing sustainably, and growing sustainably based on a inclusion, for instance, through empowerment of women, growing sustainably by taking on board the need to grow in an environmental respectful way, growing sustainably also by listening carefully to the important debate around health, and meeting the expectations of consumers and public health authorities, how our beverages and how our brands can play a role in a balanced diet. At the Coca-Cola company, we understand that the health of our business is dependent and linked with the health of our employees, the health of our consumers, and the health of the communities in which we operate. So we have listened carefully, and we are evolving our business actually to meet those evolving expectations. The Global Burden of Disease Survey of 2016 demonstrates that people are living healthier across the world, but at the same time, non-communicable diseases are increasingly important and account for more than 70% of deaths worldwide. The risk factors for those NCDs, non-communicable diseases, are preventable. And when it relates to unhealthy, unbalanced diets, we have to look at personal responsibility of consumers and creating healthier food environments. When we talk about personal responsibility for consumers, it is obviously for public health authorities to educate consumers. We see the role of the food and beverage industry to create those healthier food environments. And I just want to give you a few examples of how we are addressing this at Coca-Cola. We listen to our consumers, and we understand that consumers now want beverages with more nutrition, more benefits, and less sugar. We agree with the WHO that added sugar should not count for more than 10% of daily energy intake. And based on those insights, we are actually evolving and changing our recipes. In 2017, we reformulated more than 500 beverages around the world to reduce added sugar. Here in Russia, although soft drinks only account for 1% of the daily energy intake, we have taken sugar out of signatory brands like Sprite, like Schweppes, like Fanta, between 30 to 80% less sugar in those brands. And we will continue to do so. We're also expanding our portfolio. I'm really very excited to share that actually today here in Russia, we are launching Fuse Tea, a premium tea brand, which adds to the already 12 different brands and 85 drinks that we are offering here in Russia. Both in Russia as well as elsewhere, the part of our portfolio that is comprised of low and no calorie sweetened beverages is increasing steadily. We're also offering smaller portion sizes, which helps people to cut back on the sugar they get from our beverages. Actually, the McKinsey Global Institute has two recommendations for addressing obesity and overweight. They put reformulation first and offering smaller portion sizes second. And we as a company, we're actually committed to accelerate what works. And those two elements are the elements that we are delivering on here in Russia. Consumers also tell us they want straightforward nutritional information about what they're eating and drinking. They don't want to do the guesswork to understand how much sugar and calories they get from our beverages. Hence, here in Russia, as well as elsewhere, we are putting front-of-pack nutritional labeling so that consumers can make informed choices. And as a company, we are committed to do more, to work with stakeholders and the industry to evolve and to provide even more intuitive and interpretive labeling schemes over time. So, ladies and gentlemen, with very complex and multifaceted issues like public health, like overweight and obesity, the simple answers aren't always right, and the right answers aren't always simple. Hence, we need partnerships, we need to work together, we need to learn from each other, we need innovative thinking. I would like to recognize the leading work that the government of the Russian Federation is doing at international level, at WHO level. As part of the food and beverage industry, we will continue to engage, we will continue to listen, we will continue to learn to find the appropriate way how we can deliver and how we can contribute to this important debate. Thank you very much.
Спасибо большое. У меня вопрос.
Thank you. I have a question to Andrei Nikitin. Andrei used to be the head of he has been the head of the Agency for Strategic Initiatives for many years, and we've been working together on the topic of national development. Now you are the governor of Novgorod Oblast. You are a governor, and has your opinion of how it all works, has your vision changed today that you are a governor now? What are you doing now to make the population of your region feel comfortable living in your oblast, in your region? Thank you. Thank you, Alexander. Good morning, colleagues. You know, sometime at the end of a time when I worked at the Agency of Strategic Initiatives, we discussed with Alexander that the investment climate is not just about doing business or the quality of life, quality of education, quality of healthcare system also matters and becomes even prevailing when the investors are choosing in which region they would like to open their business. And today, we cannot boast having very good figures health-wise, and there is definitely a room for improvement. And you know the problems we have, like a typical Russian region, having a low density of population, having lots of population living in remote villages, hard to access. I think today they still have a unique chance which they never used to have before, because now we can start solving the existing problems thanks to the latest achievements of modern science, thanks to innovations, and thanks to digital economy. And today we focus on three main things. The first one is probably not the most innovative one, but the most important one. This is what is described by an old good word, propaganda. It's propaganda of healthy lifestyle. We have regional media, regional newspapers, regional television, and from December last year, we started a project called 12 Months of Health. And, you know, we every day say that you need to have healthy food, you need to think about prevention, you need to pay attention to the very first signs and symptoms of some diseases like stroke, for instance. And December was a month of wholesome food. It was a pre-New Year month. And we really managed to launch a very extensive media campaign to promote healthy lifestyle, because I think that the main problem is that people, they do not really care and that much, and they do not do some simplest things in order to preserve their health. the second problem we deal with is related to the digital economy, and this program was launched and it was endorsed by the leaders of the country. But this program is very important also to ensure such important things as availability of diagnostic opportunities. And thanks to the support of the Ministry of Health of Russia, Veronika Skvortsova, we managed to achieve a lot in terms of mobility. Now we are acquiring, and we will continue acquiring mobile healthcare units so that people could have their health checked on a more regular basis, so that if they do develop a disease, the disease would be detected and diagnosed at an earliest stage. Another third topic, which too is very important and which we work on, is the following. There is no country in the world where there is an abundance of budget funds, right? That's why wise spending of the available resources, wise procurement system is of importance. We started a special project with the National Bank. It's a blockchain project on monitoring of the medicinal products use in hospitals after they have already reached the hospital. When the medicinal products are delivered to the hospital, we monitor how they are further distributed and used. It's a small project to see whether it makes sense to escalate it and to expand it or not. But we very much hope that this project will help us exclude repetitive use of medicinal products. It's like the nurses who are supposed to deliver the pills to the patients. Sometimes they snatch a bit and sell them to someone to make some money. For me, public health is definitely one of our priorities. It's like having good roads. This is a must. So we are approaching the economics topic as well. So where should we and where can we take money, and how can we marry the interests of the state and private investors, and whether private investors can help to make the society healthier. I would like to give the floor to Pavel Kadachnikov from the Center of Strategic Development to share with us his opinion about this topic. Thank you. You know that we at our center are preparing proposals for the strategy for the coming years, and one of the topics we are working on is how to ensure sufficient budget for the healthcare system. Now, this discussion of budget spendings that are productive and that are not productive, this discussion is ongoing in many countries currently, and when we are talking about productive spendings, which result in increasing lifespan and improving the health of nation. This is one thing, and non-productive spending is something else. For Russia, the economic growth rate is insufficient. We understand that, and we can easily increase it. We should try to increase it to 4 to 5%. But if we take together all the private, public investment, foreign investments, we could have 2% of this, plus 2% on top of it could be made thanks to improvement of the labor productivity, and the state is not able to give us anything apart from what I just mentioned. And like all the previous speakers said, in this current world, the world is becoming human-centric, and it very much depends on humans, on people, our further success. And that's why the people and this human capital is our priority now, and we need to give an opportunity also to different regions to increase their resources. Currently, we spend about 3.3% of GDP on this, while it should be about 4% to be able to catch up with other countries. In education, we spend 3.6% of GDP, while it should be about 4.4%, and I think it's doable. If we had achieved these figures when we understood we should achieve them, then of course now we would be enjoying growth rates which would be much higher than what we currently have. And now the question is not how to increase these resources, but also to understand how are we going to see the result of increasing resources. How and when are we going to see the increase of lifespan and so on? And now, in terms of public administration, for instance, there is a discussion of how to change the public administration so that all the money that is being spent on public health and on public assistance is productive. Konstantin works in the Board for Foreign Investment, where they discuss the business climate in Russia. And not long ago, there was a decision made to make a study to see whether the foreign investments by foreign pharma companies working in Russia are really in line with implementing the government's goals to improve the public health. And I would like to ask Anna Guseva from YE to tell us about the results of the program. Thank you. Good morning, and thank you. You are right. Over the past 12 months, we have had a very extensive study to see the contribution of Russian and foreign pharma companies into the development of the pharma industry of Russia and into the development of the whole economy. And we saw that the volume of Russian and foreign investments exceeded 300 billion ruble over the past 10 years, and the total cumulative effect was 3.3 billion, and this was without the impact of foreign players, but considering the investment of Russian pharma companies, because this program also looked at the figures on modernization, on partnership programs, on educational programs in pharma industry. And I would like to say that this investment was very much favoring the Pharma 2020 program implementation, like creating about 15,000 jobs in the pharma industry, and also creating a foundation for more innovative developments of the pharma industry in future. At the same time, the market experts and the market players say that to implement all that we are supposed to in pharma industry, we need to pay more attention to development of regulatory provisions in order to ensure sustainable growth. And number one priority was to also think about the protection of the intellectual property, which was mentioned by all the market players. Plus, it was mentioned by all the market players that if the market authorization could be obtained earlier, it would be beneficial for the patients first of all and for the society on the whole. And of course, everyone is championing the importance of transparency of the markets. The companies are now investing a lot in localization of production of medicinal products, and these companies would like to have certain benefits like risk-sharing contracts and the like. And it was also mentioned that to provide for efficient collaboration between the market players and the state, it would be great if we could develop certain tools to quickly pilot the innovative treatment schemes and to extrapolate these schemes depending on the results of pilot projects. And the pharma companies also mentioned that the efficiency of collaboration between the industry players and the state could be even higher if the regulation of the pharma industry and control over pharma industry were performed by the same state agency, which could help to overcome various disputes and discrepancies which sometimes arise. Plus, we also needed to ensure state support for development of new medicinal products, and it was mentioned that it could be good if there would be a venture fund created, which could be working under the aegis of the Ministry of Industry and Trade. Plus, we discussed the importance of implementation of personalized medicine, which could enhance the efficiency of the existing healthcare system. And, of course, the dialogue between the pharma companies and the state should continue and become more productive. And it should include not just the representatives of healthcare institutions, but also producers of medical systems and devices, pharma companies, and healthcare professionals, and all this should be integrated into the Pharma 2020 program. Thank you so much. Talking about the foreign investments, we know that foreign players keep on coming to the Russian market. At the same time, we see that the volume of foreign investment into the pharma industry, as far as we know, is slowing down a bit. My question is to Vladimir Vlasov from Novartis. What do you think the state can do today in order to keep the volume of investment into the pharma markets? Good morning, distinguished ladies and gentlemen. This question is a follow-up to what Anna was just talking about. Anna Guseva gave you a full list of wishes, a full wish list of pharma companies. And from this wish list, I would talk about 3 of them, because we have to prioritize. Our company was the first one to welcome the Russian government's invitation to participate in 2020, in Pharma 2020 program. It was in 2010, and since then we have built a huge modern plant in St. Petersburg, but it turned out that welcoming the governmental proposal, we helped the Ministry of Industry and Trade to deliver the KPIs they were supposed to, while the pharma company in Russia is controlled, monitored, and inspected by at least 5 ministries and agencies. Is Ministry of Industry and Trade, Ministry of Health, Ministry of Finance, which is in charge of regulation of state procurement system, and Federal Anti-Monopoly Service as well. And when there are so many stakeholders, it is a real headache to try to build a long-term strategy, viable strategy. That's why our first wish is to have an opportunity to plan for long-term development of our business based on the existing rules that do not change every day. What are we talking about? All the medicinal products can be, in a simple way, divided into 2 groups. Innovative, which are covered by patent protection, and after the patent expires, anyone can produce them, and these will be generics already, and generics should be much cheaper than the branded medicinal products. And in our country, we have all we need, talking about the legal provisions, but yet in our laws there is still a gray zone which needs special attention. It should always be on the radar, and it really requires strict monitoring. Number two, innovative medicinal products should be available and accessible to as many people in the country as possible. And for ensuring this, we need to take an innovative approach to procurement, and when we focus not just on the number of pill packs sold, but on the result these pills produce. Thank you. Thank you so much. And now I suggest we start the next part of our discussion, which is about infrastructure, because in our country we have a complex problem to improve the infrastructure in public health and healthcare system, and there are some regions which are far ahead of others in this respect. And I would like to ask a question about this to Rustam Minikhanov, President of Tatarstan. I would like to ask you what has to be done in a region, at the regional level, to ensure good health of the population of the region. Thank you. Good morning.
Good morning. Thank you very much. Deliberating on the subject of infrastructure, we should talk about it as a complex phenomenon. The quality of life is made up of a number of aspects and requires a systemic approach. Without major investment into infrastructure, it is next to impossible to achieve specific results. As to Tatarstan, we have sought to devote requisite attention to the centers of public health, and these innovation centers have helped us to find some bottlenecks. But it turned out that we are lagging behind on pretty much the first tier. And we have in the past several years invested a lot into the first tier, which is the modular units. As we spoke with the minister, we have already produced over 400, and we have put back on track a whole number of public health objects. We have seen, unfortunately, that our city polyclinics and indeed outpatient facilities have been lagging behind. So we have, alongside with opening up clinics and outpatient facilities in the countryside, we had to go back to our city infrastructure and really revamp it, because this is clearly the case, as my colleague Andrei has said. We have been helped a lot by the system of information technologies. My colleagues here would, I'm sure, agree with me if I say that any doctor, any physician is encountering a host of technical issues, many of them minor, that he or she must comply with. And we have to realize that these digital technologies bring up a new quality of work, And the professional, the high qualified cadre is indeed of paramount importance, and this is something that we are expecting to continue to invest in. Thus, we have to continue with the unwavering efforts of raising the educational level of our specialists by having them trained at the best medical centers, inviting experts to come and help us train our people. And this is indeed number one priority. The situation which we see in the countryside. Today's information technologies allow for a 24/7 contact with the best medical centers who provide recommendations on a virtually uninterrupted routine. But, as I said, without major investments into infrastructure, without major investment into education and training of professionals, we are not going to achieve success. So we adhere to this task. Thank you. Well, thank you. And you have mentioned the role of information technologies, and I think it is quite pertinent to ask Mr. Malinovsky of MasterCard to tell us more about the project that the company has accomplished in Russia. Indeed, MasterCard is a technological company. We are dealing with technologies which allow us to be in a very multifaceted universe. So I think that this complex approach is quite reasonable. And let me impart to you our experience in healthcare and medicine. The project that we have accomplished in Zelenodolsk in Tatarstan is called the Map of citizen in the Republic of Tatarstan. We're taking a bank card, just a plastic card, and thanks to the chip to have quite an array of information possibilities, we have amended this card with a non-financial content by introducing the applications which have been developed by the Russian software developers, and these applications allow not only to make payments but to use public transportation, to avail of the social services, and have the electronic signature, the digital signature, the social security number chipped in. This card is issued by banks in this region in a matter of 10 minutes. And what does it give a patient? When a patient arrives in a clinic, he or she may apply the card to a terminal to get registered for a doctor's appointment, or else he or she may immediately download and draw up the history and the medical history of that patient. The overall speed of registering for doctor's appointment has risen fivefold, which is, I think, quite indicative of the fact that both the patients and primarily the doctors, the medical staff, will have more time available to them to deal with exactly their professional duties, and indeed reduce the paper burden, or indeed the information processing burden, which has thus been automated. When we talk about a medical healthcare provider, a representative of a medicine, the doctor may put into this card the formulas or prescriptions, and the patient would go to a drugstore also equipped with such a reader, and the pharmacist will immediately see information springing up to the screen with the prescriptions issued by the doctor, alongside with the discounts eligible for this patient, which indeed increases the transparency of the system. It has always been illustrative for me to see how the EMS, the emergency medical services, work. In this project, our EMS cabs, in case of emergency, may use this card through the reader, which has been given to this car, and indeed these policies may save more lives in emergency. The unified standard of the level of infrastructure. There is no need for unique infrastructure, as we are working on the open international standards available for the banking industry, and this allows to certainly release the burden, and the modern chip used for a card provides for the requisite level of information protection. Clearly, this project would be inconceivable without the help on the part of the government of the region, for which my special thanks go to the government, and the local partners who have been instrumental in understanding and allowing us to work within the ambit of this system in the Republic. We believe that the technology has a big future for other regions of Russia. Thank you. Well, thank you very much. Colleagues, we have about 30 minutes to go to have this conversation consummated. So let me ask colleagues to confine yourselves to about 3 minutes. We are trying to build a healthy nation, but that being said, we unfortunately have many of our compatriots who are sick, who are ill, and I would like to ask Svedemese to talk about the palliative medicine, palliative care. Well, thank you for inviting me, and it is not accidental that I have asked Mr. Mao to be able to talk about this topic of palliative care at the Gaidar Forum. And the Gaidar Forum is important, as Igor Gaidar was instrumental in opening up the first hospices in Moscow. And indeed, Moscow, in this sense, is quite in a good shape from the standpoint of palliative care. However, as we speak, that human must stay a human, and unfortunately we are all to die. So this is something that every person will definitely encounter, the sad but unavoidable topic of palliative care, either for in the standpoint of a personal experience or the experience of those close to us. So unfortunately, this is a topic which is often curbed, and many representatives of the different systems and governments, people try to shield themselves. And when we speak about the quality of life, it certainly relates to the entire span of our life. Palliative care is something that is needed by over 1,300,000 persons across Russia, of 2 million persons who die every year. About 75% require palliative care. And That being said, only about 300,000 of these persons, the terminally ill persons, receive the requisite analgesia. It is indeed a shame. It is a shame that many of our fellow countrymen have to fight for their right to get morphine, to obtain analgesics, to obtain the painkillers towards the end of their earthly existence. Let me ask all representatives of the government and the governors of the regions. There are cases, there are regions in Russia where the case of palliative care is at the level of the end of the 20th century by the Russian standards and the beginning of the 20th century by the world standards. And Mr. Murashka, Veronika Igorevna Skvortsova have been fundamental and very helpful in moving this forward. But what I would like you to understand that if we are to talk about allocating budgets to have these billions and trillions that need to be invested, unless we have a situation that only 300,000 of 1,300,000 persons who require palliative care, only 300,000 get the requisite care. So the costs are often incompatible with what we are usually terming as the quality of life. And indeed, if we believe that palliative care with the requisite analgesia, which can indeed be produced in this country, unless we resolve this issue, then I think we may be moving towards the situation of embettering public health. Indeed, we have longer lifespans, and not only do we live to see our oncology, but more and more we will continue to live to see our Alzheimer's and dementia coming to have their detrimental effect on more and more people. And indeed, palliative care and hospice is the only thing for many of people to resort to towards the end of their lives. So let us deliberate that 4.3 billion rubles as promised by President Putin for the development of analgesia and palliative care need to be expended with great care, because I think these are questions related to our parents, to those close to us, and this is indeed also about the quality of life of our children. I'm doing this for my children and for the children of all of us, because we have to understand that this is a part of human condition. Thank you for your attention, and let us just think about those who are weaker.
Thank you very much. And now I have a question to Marwan Akar from MSD Pharmaceuticals. Which areas in Russia need now foreign investment?
It's here not for me to tell the Russian government where to focus, but I speak a bit globally and share with you some of the trends I'm seeing in Russia that I actually agree with. If you think about it, when it comes to prioritization, it's tough when we're talking about lives. But of course, the disease burden in many countries continue to be there, and healthcare costs are going up. Therefore, governments must prioritize. However, it's guided by two factors: outcome and impact. It becomes easier for governments to make decisions on where to focus. So it's not by error that most, if not all, countries have been vaccinating children for the last 50 years. again, it comes down to outcome and impact. And this is why you're seeing many governments expand their vaccination programs to include some of the more recent innovation in vaccines that are not specific to children, but also adolescents and higher risk groups, just as seniors. So my recommendation would be to focus on that. And actually, that's already happening in Russia based on the recent announcements we heard from the minister in terms of NIP expansion starting 2020. The other area I would say is continuing with infectious diseases. It's HIV, and Russia has prioritized that as well, as many countries have. There is, of course, more opportunity there, but the federal program, I think, will enable this. And finally, I would say there's an opportunity also to do something similar in HCV based on the new therapy that we're seeing that's resulting in cure. So again, if guided by outcome and impact, it becomes easier, although, you know, in an ideal world, you'll do it all. Now, to assess outcome and impact, we as MSD are partnering with multiple institutions here, such as RENEPA, Skolkovo, and others to actually make those assessments through our Innovation Center of Excellence. We do this both at the federal level as well as at the regional level with many of the ministries of health in those regions. So that would be my recommendation, is to be guided by outcome and impact. Thank you.
Спасибо большое. У меня еще вопрос есть еще одному международному инвестору, который будет...
I have a question to another foreign investor in Russia. It's Johnson & Johnson. Ms. Rubio, based on your international experience, what's the influence of the healthcare sector on the national economy on the whole? Are there any ways to assess the impact?
Good morning, everyone. A real pleasure to be here in the Gaidar Forum. So let me maybe start by saying that I think that the relationship and the connection between investment in healthcare and economic and societal growth is very well established, and I think that many of the speakers today have referred to a strong and factual data that support that reality. And while this is true, I will say that it's even more true that the connection between innovation in healthcare and economic growth is well established. And on that, I think that more and more we see governments all across the world really acknowledging that innovation really is a currency for growth nowadays. We, Johnson & Johnson, are fully focused on innovation as the biggest a company operating in healthcare. As you know, we are broadly based in medical devices, pharmaceutical, and consumer and OTC. And we do believe that working in healthcare is on the one hand a great privilege, but on the other hand is a great responsibility, because it's not just about innovating and bringing new drugs. We do spend around $10 billion per year in R&D, but even more importantly, it's about bringing innovation and making it available for patients. And I will say that this is even a more challenging endeavor, given the fact that we are in a super positive context, I will say, as the humanity, in which innovation is blooming. Last year, close to 50 new drugs were approved by FDA. This is the record of the last 20 years. And of course, while this is great news, of course, it puts a lot of pressure on healthcare systems, and companies like ours, leading companies like ours, need to find our way together with key governments like the Russian government to make this innovation available. And of course, partnership for us is a great tool to make that happen. So we are very much betting on local manufacturing. We are manufacturing current nowadays up to 12 drugs with different key local partners. We do believe that further getting involved in clinical development in Russia is a key way to go. We understand that in the upcoming 2030 plan, Pharma 2030 plan, co-development of new drugs with Russian partners will be an important priority for the government, and we are willing to take that step. And of course, collaborating all across the place with different stakeholders in the healthcare ecosystem, like, for example, the Skolkovo Innovation Center. We just announced an important partnership to sponsor a number of startups. So I think that partnering is one of the key answers to that question. Thank you.
Спасибо большое. Ну,
Thank you very much. We spoke a lot about public-private partnership at the regional level in the system of healthcare, and I would like to ask Sergei Morozov from Ulyanovsk Oblast, tell me, what are the main benefits of public-private partnership in public health, based on your regional example? Thank you very much. I participate in a lot of Russian and international forums and conferences, and it's difficult to find a forum where we do not discuss nowadays human potential. And still, I think that we usually start tackling a problem enthusiastically, and then little by little we forget about it. When we are talking about human potential in our country, there is still very much to be done about it. Let me give you an example. For many years in our regions, we tried to convince federal authorities and regional authorities that this is very important for our country, especially in crisis times. Thanks God, nowadays we managed to improve and further develop the city environment. But in terms of public health, unfortunately, we don't have the same approach and success, and I can give you lots of examples about it. Number two, it would be great if the federal government, like with the city environment program, if the federal government could also proclaim it as a special program, I mean public health or healthy lifestyle, with training on healthy lifestyle priorities and implementation of this program, like you organize these programs for monacities. And then we would probably see more jogging lanes and more opportunities to lead a healthy life. But I also think that we forgot too early the good old experience we had in Soviet times, when even the industrial enterprises, they did think about healthy lifestyle of those who worked at them. And I can tell you that such corporate culture program, it did exist in all times, but now, if we look at what we have currently, all doctors' offices have been closed at major offices and major companies and plants. All those programs that we had, like physical exercise and whatever, all they have been forgotten and closed long ago. So probably it makes sense to remember the Soviet times experience, and maybe it really would make sense to organize this project now in modern Russia. Many companies really enjoy, big corporations enjoy state subsidies for health, and still they do not spend anything on health of those who work in them, and we have to allocate from our regional budget money to improve the state of health of the working population. And of course, we if we cannot very dramatically increase the amount of money to be spent on public health, and we understand it's not doable, so what's the solution in this case? Public-private partnership. You know, a few years ago, together with my team, we prioritized our spending in healthcare. And first of all, it's cardiovascular. Uh, Diseases, because cardiovascular diseases are a priority in this case. We need to tackle this problem to reduce morbidity and mortality, which is real high. And now endovascular interventions, many of them are being done in the PPP format. Number two priority is oncology. And just 2 days ago, we signed a new agreement in the framework of public-private partnership. This is an agreement for treatment of cancer in partnership. And by the end of this year, we will build a huge center which will provide high quality, modern medical assistance based on latest technologies for more than 600,000 people a year. We are implementing this project, and you know why it is so important? We have a program of state guarantees, which is 13 billion rubles. The volume of investments that we are currently attracting into this area is more than 10 billion rubles as it is currently being assessed. And I think that we are going to go forward with these programs, and we are going to train our team for this program in Israel and America, taking the best of foreign experience. Thank you. And now let's talk about digital technologies, which we have very briefly touched upon today. Today, worldwide, at any forum, digital is being discussed at any session. And of course, we are not an exception to the rule. And I would like to give the floor to Oleg Fomichov. I would like to ask Oleg to tell us what have you provided for the health sector in your state program, the program entitled Digital Economy. Now it's not that much linked to industries. When the program was being developed, there were a couple of blocks including digital education, digital health system, but now we are going to launch a digital economy at the next stage, but at the first stage, and it will apply to all the sectors, including education and healthcare. It's a horizontal development of everything that is related to research and development in industries, and we are talking first of all about general regulation in terms of integrating basic notions and definitions related to digital economy, digital healthcare, and so on. And we also need to lift the existing barriers to digitalization of all our industries, and this is also one of our top priorities today. We need to do away with the existing limitations and barriers, and we need to improve regulation and in the area of personal information, personal data, patient data, which have to be protected. And till the end of January, we are supposed to perfect the roadmap in terms of education. We have to do that till the end of this month together with the Ministry of Labor of Russia. And that's also important. We need to modernize the labor relations in various sectors. And of course, we also want to implement HR trajectories which would enable professionals and employers communicate with each other without the standard paper labor records and whatever. And at the same time, we understand that digitalization is now a key priority for all sectors of economy. And I think you can also add a lot to what I just said, because, even though the digital healthcare is not yet part of digital economy, still we are digitalizing the healthcare sector as well, and we have already done a lot, and this will be included in the digital economy soon.
Thank you very much. A question to Leon from AstraZeneca. Your company has been historically very strong in R&D. What are the research projects which are of specific interest for the Russian market?
Yeah, I just take over the emerging market at AstraZeneca, so including China and Russia. So I know less about Russia, but I know more about China. So maybe I share with my perspective from China, but it's just for reference in Russia. So when I talk to the government in China, actually, they need three things. They told me they need three things from us, AstraZeneca. First is innovation. Innovation means a new drug that can be developed and launched ahead of US and Europe, rather than just follow US and Europe, and also the digital healthcare and the Internet of Things. So they needed these two things. And the second, they have a large population and they need to serve with a local, good quality, low price, huge volume, generic industry. They need a universal access to medication. And thirdly, they need a quality care because people go to crowded big hospitals. And the low-tier hospitals, doctors are less capable in dealing with the situation, so they do not have enough good quality doctors to deal with all the patients in the healthcare system. So then by doing this, actually, AstraZeneca is very proud to work with the central government. Recently, we launched three things. One is herbal medicine doctor alternative intelligence. By putting your face, show your tongue, and open your eye, and put your pose on the automatic machine. And this automatic machine is the knowledge of many herbal medicine doctors in China, and they defeat also many herbal medicine doctors in China also already. So by providing this doctor herbal medicine to many low-tier hospitals, and they actually can provide a good prescription for reference for the herbal medicine doctors. And the knowledge actually coming from the leading 100 herbal medicine doctors in seeing their patients, so then accumulated into the digital system. And also we work with Alibaba in China, so we invented Dr. Yu for diabetes treatment, and learning from the leading 100 diabetologists collecting their patient card. And already we launched Dr. Yu and to help the low-tier hospital doctor in getting reference on how they treat diabetes patients. And now we are working with a lung cancer doctor, even more complicated. So 100 leading lung cancer doctor accumulating 10,000 of lung cancer patients visiting hospital 30, 40 times in their limited life survival period. So in order to accumulate the knowledge, in order to help these patients. So this is one part, and as a pharma company, we believe we're not just selling product in one country, and we believe we can integrate a total care healthcare solution in order to help the country to deal with the disease in a more efficient way. And also by localized innovation, now we have 7 new products will be originate from China and will be launched ahead of US and Europe, and one of them will be launched in the middle of next year. And we have 4 late-stage development and 3 early-stage development. So altogether 7 new products ahead of US and Europe in China. So in China for China and in China for globe. So this is also happening. And so by doing this, we are supporting the China innovation and our manufacturing side, because we put down the investment in China, and the government is giving a lot of good condition, and continue to support us in the long term. Now we are exporting to 60 countries, and we'll be exporting to 100 countries. Yeah, sorry. Well, to 100 countries. So in order to achieve these 3 things, so I think speed up approval is not just for importing more new drugs, also helping local innovative pharmaceutical industry. And also the policy, I agree with Novartis CEO, is about the stability of the policy, and we need to have a consistent national strategy, and we cannot change from time to time. And the last but not least is cost. So the government in China actually keep the drug price actually quite high in order to protect the local industry, because we believe we need the local industry to succeed in order to generate the innovation. So that's why we keep the generic price relatively higher than the other countries. So that's also one of the things that I think we need to consider. So,
Thank you.
Thank you.
Yeah. Thank you very much. Спасибо большое. Ну, Последний, наверное, вопрос. У нас осталось буквально...
Well, we have 2 minutes, and it may be a provocative question. It is a widespread knowledge that modern state-of-the-art technologies are bringing new quality to life. There is also a different viewpoint whereby the social networks and social media may be detrimental to the young. And I have asked one of my students to give his iPhone to the neighbor. And there was a discomfort as the phone was migrating from the person along the audience among the students. So why am I saying that? Is that people may be losing comfort. Is there no threat in the technologies? And do we believe that there is an adverse effect of technologies on life? Thank you. This was a question to Mr. Bochenek.
For inviting us to join. I would say the following. I think there is always a threat in everything that we do, right? In any technology that we are using. But I think the most important is to focus on what this technology can bring and what kind of change it is making. And it reminds me about my first meeting with Satya Nadella, who is CEO of Microsoft, who shared his personal experience about his son, who was born with serious health problem. So he really gets it, right? Because he's living with a guy who is still facing the severe health problem. Because at this point of time, technology was not able to fix the problem that technology can fix today. So, and that made me think also about the progress that has been done over the last, let's say, 10 years or 10, 15 years, which is quite dramatic. And let me give you maybe two quick examples. I understand I've got 2 minutes. So
let's do one.
Let's do one. Okay, let me. That's not yet from Russia. I hope I will be able to share the example from Russia next year. But the one is from the Seattle-based company that is investigating or making a kind of a research on the blood to understand the immune system and so on and so forth. So they are in this business for many years, but by partnering with the technology and implementing technology, they were able over 10 years to reduce cost by 1,000,000 times. Not 10 times, but 1,000,000. So which means that the cost of reaching or helping one person is equal today the cost of helping 1,000,000 people. That's a tremendous change, because that if you think about this, you can scale the project so much or help so much more people. That's one thing. The other one is on the side that knowing or having all this information, you can compare this with information from other people if you've got the right scale that allows you to understand what is the best treatment that you can offer to patients in such a situation. And these are millions of data. Healthcare industry accounts for approximately 30% of the data that is stored on the planet. So this is massive change in terms of technology. Don't know whether I answer exactly the question you asked, but I try to do my best. Thank you.
Thank you very much. Спасибо большое. Ну, мне кажется...
Well, friends and colleagues, thank you. I think this has been an invigorating discussion and a very interesting event. And if I may ask Veronika Ingerovna to have a short comment on this business breakfast. Thank you very much indeed. Thank you, Alexander. Esteemed colleagues and friends, let me thank organizers first and foremost for this business breakfast and the subject chosen, which is, I think, the most, the widest, and life is what we have in sensation, and probably it's an all-encompassing subject. Let me thank all participants for your viewpoints, positions, and the different aspects and facets of this subject that you have illuminated. Let me remind ourselves that the topic of public health was born in the Soviet Union in 1978 in Alma-Ata. The Alma-Ata Declaration was adopted for the public health and the primary health care. Today, in 2018, together with our colleagues and friends from the Republic of Kazakhstan, we are commemorating the 40th anniversary of this event, and the World Health Organization will hold a Jubilee conference, and with respect to the Russian Federations, the guidelines are then accepted and adopted continue to be developing, and as we have seen, that there are some results. Well, first and foremost, we're talking about the population-based methods related to the social groups, and when we go back in time, we have been able to overcome in part such, and we have been quite successful in combating smoking, thanks to the very comprehensive law on containing tobacco smoking. We have been able to significantly indeed to decrease the number of smokers among the adults and the young. We have been able to decrease by 80% consumption of alcohol per person, to increase fourfold the number of those active in sports. We have formulated the guidelines for healthy diet and the national strategy for non-communicative diseases, which is in part dedicated to the topic of healthy nutrition, is indeed considering this. And I thank my colleague from Coca-Cola, who understands that the principles which are embedded in the national strategy, and that the efforts are being taken to decrease the number of and the content of hydrocarbons. These measures make up for about 60% of the overall contribution to increasing longevity, and our base must be improved and taken on further based on the WHO data. We have gone to take the second place in the world by the dynamics of public health in terms of in emerging economies, and this parameter has been taken by all departments of WHO, the 8 departments. There have been some questions related to the industrial side of the question. As of 2017, we have concluded an agreement with the Russian Association of Entrepreneurs and Businesses. We have introduced some guidelines on the corporate healthcare, and we do not have a verticalized system, of course, which could allow us to enforce these. So we're acting through employers, we're acting through heads of regions and the governments of the regions, and we do hope that together with the business circles, with the governors, we'll be able to launch these programs. But this is and this let me just draw your attention to that this is a devolved system. It's a system of decentralized system, and we just have to be patient and consistent. So while we have covered almost all of the aspects making up the subject of public health, let me just conclude by saying that we have been able to make some advances in making the healthcare more available, and the very fact that the first geo-informational system has been created to understand better the demands and the healthcare requirements across the country. Having a better understanding of what needs to be available on the primary, second tier, and third tier medical establishments, specifically during the life-threatening conditions. So this is no longer a patchwork, but a systematic approach of 75,000 settlements in this country. We have been able to develop a roadmap on a massive scale. For the first time, we have created a quality management program, which include the clinical recommendations as written by our esteemed scientists and medical experts, as supported by the World Health Organization guidelines, including the actual follow-up and supervision, which we believe will pass into the electronic benchmarking in a matter of 3 years. And we do believe that the digital technologies which are already making their way into the medical practice in this country will continue to calculate the integrated quality indicator. So the legal base and the technological base have been conceived. But what we need to do is to implement these and to hone the skills for using these instruments. And this is what we have to work together. As to the financial component, with all difficulties of the past several years, the contribution to healthcare has been going up every year. And if we compare this year, the last year it was 333 billion rubles plus, so 21% increase. The subventions to the regions have also been going up. The oncological, the cancer treatment, including chemotherapy, has gone up 30%. The surgery, 60% compared to the preceding year. And I can go on giving the numbers, but let me just confine myself to saying that we are specifically interested in concentrating the resources for the priority of this year is oncology. Cancer treatment as #1 priority and for this year. So we have to be talking about the private and public partnerships. Today, in the Russian regions, we have 118 investment projects, which is over 72 billion rubles. If we only take the federal centers, 31 investment centers in 22 clinics. Only in 2017, we have started on 4 concession agreements, and the mechanisms of these have become our everyday practice. We're seeing a great interest on the part of our foreign partners, and this year we know that we will be developing our relations with our European, North American, and Australian partners. Of course, the information technologies. There's been a great achievement in 2017, which was the law on digital medicine. It has been of importance that we could to make an idea widely available among this motley community of digital medicine, and to understand that the digital information must be available to the patient himself or herself. No digital codes would ever allow for 100% protection. And so it is the patient who makes the decision of whom to impart to these data. But the physician must always be gaining the accord on distributing this data and sharing these further. And we know what era we are entering, and all 80 subjects of the Russian Federation are involved to a different degree with the digital medicine. We are passing on to the documentation in the digital formats. Most of Russia's regions have centralized laboratories, and the overall lean technologies which are being introduced to the outpatient clinics have generally been made a part of the system. So we think that this will only be important if every person decides on the fate and the actual thing of whom to share with his or her information. This is the important thing. The human-centered, the patient-centered approach presupposes that it is the patient who decides to share around his or her medical data. That's an important point. We are developing a system on early diagnostics of lung cancer and some other cancers, and we have been able to involve experts with the micro with the actual micro manifestations of the disease. We have to thank Andrei Nikitin for raising the topic of the pilot projects for telemedicine and the telemonitoring of the risk patients related to arterial hypertension and diabetes. This is a step we shall make in 2019. As of this year, we have to polish the already existing telemedicine system, which would bridge all of the existing systems with the actual third-tier clinics to have a 24/7 availability of experts and doctors for difficult cases, there's been a host of questions raised during this business breakfast. I agree with Nuta about the importance of palliative care, and let me just emphasize that we are trying to make palliative care a more developed part of our medicine. By 40% we have increased the number of beds for palliative cares in the Russian hospitals, and the analgesia is also the question which we are continuing to explore and try and resolve. The question is not as acute as it was 2 years ago. We have been Russia has always been important for its creative potential. We have special talent. We have a great potential to untap, and the overall system has allowed to shorten the innovation cycle 3 times. We believe that the breakthrough medications and the breakthrough technologies for medical purpose, biodetectors, sensors, it has taken us 15 months from idea to launch. A 2-vector vaccine for Ebola fever is an example. This is something that we have started that has been started in West Guinea in Africa, and the President of Guinea has awarded state orders to some of our infectionist doctors and scientists. The virtual clusters is the way to go. Let me conclude by my thanks, by expressing thanks to all of you, and by illuminating the different facets of this stone, of this diamond. We are happy to cooperate with you, and we're open to all discussions and questions. Thank you very much.
Dear colleagues, I think we had a very good discussion, and we are already being waited for in the 5th building. That's why we are asked to wind up this business breakfast. So have a very fruitful day and good business meetings. Thank you for being with us today.